from that and immediately went to the ozone conference, and he separated by 3 days later I went to the Best Answer to Cancer conference. So having attended 4 conferences since we've last been together, I can only tell you that we're living in exciting times. And to give you a hint, as you know, lasers and pulsed electromagnetic field have changed my life, and energy medicine is absolutely no longer any question is the medicine of the future, but it's arrived now. When you have data from Dr. Pott, who came all the way back from Vienna to give us another presentation, which I've already discussed in the past, when I told you that when she was treating patients with ovarian or prostate cancer, that simply adding the use of a laser took the tumor marker test back to normal when otherwise they only partially reduced. So we know that this thing is kind of important. But I have to tell you that ozone therapy is life-changing. And if I could just tell you that anybody who has even a pet that they're telling you needs to be put asleep. We had a brilliant doctor, Margaret Roman from Boston, present over 9,000 pets, many of whom the competing vets in her town of Boston said there's nothing you can do but put the animal to sleep. I bring that up because when you get animal after animal that it's end of its life with cancer, and you give ozone and the animal lives another year or two, and you go back to horseback riding, or the dog lives or the cat lives, it's not placebo with those animals. And so I just want you to know that it's gotten to the point that everything that is sick in your body, whether it's a cancer or heart disease or depression or toxicity, in general you're dealing with electron deficiency. And so when we have a deficient electron, hydrogen ion can help fill that need, and we can get hydrogen out of a zeolite that we'll be releasing within the next 4 to 6 weeks. I've already mentioned it to you in the past. We won't go into great detail today because there's too much to cover. But I do have to have all of you aware that without doubt the time has arrived for ozone to become as widely used in America as it has been in the past 20, 30 years in Russia and Germany. Unfortunately, we did have over 200 health professionals in Dallas, and we had many vets and many dentists, and we are actually now working with the PEMF New Biomed. New Biomed is the name of the company that sells the lasers, the PEMF, and now has introduced a amazing $16,000 device that allows you to treat yourself with ozone and steam. Why is that important? Well, because in America you don't have too many states that are tolerating doctors using ozone properly, which can be given so many ways. Rectally, you can put on a stethoscope and let it go into your ears and have your hearing gets restored, your vision, or you can wind up putting it in the vein. But since it's kind of a little problem for doctors to handle their medical board, it's going to be hard for them to argue with people bathing in ozone. So all I can tell you is that 3.5 days of presentations at the ozone conference with the help of Dr. Frank Schallenberger from Carson City, who's the head of the Ozone Association, will tell you that when you have an infection, I don't care if it's AIDS or hepatitis C, I don't care the name of your infection, I don't care if they tell you you're going to die. As you know, I have an infection protocol, and if you're not aware of it, contact Longevity Plus and you'll get the details of how much kyolic, how much homeopathic products like the ACS, the silver, how much vitamin A, how much vitamin C to take. We have answers to keep anybody alive with these infections, but nothing is as quick and easy and predictable as ozone. But you're listening today to a discussion in which PEMF and laser is increasingly finding use in cancer. So I need you to know that this book, I've already told you in the past about a book called Cancer as a Metabolic Disease by Thomas Seyfried. That book alone is revolutionizing your power to keep your loved ones alive and to make appropriate decisions for your cancer. Because in that book, Cancer as a Metabolic Disease, Tom Seyfried, head of biochemistry at Boston University and world expert on brain cancers, tells you with 2,000 references why whatever you do, don't rely on chemo and radiation. But this book I'm showing you now is a friend of mine, Joseph Brenner, practicing at the New Hope Medical Clinic in Tel Aviv, Israel. He's been the head of a large hospital for many years because he's a rare bird in oncology, trained in both radiation oncology and chemo as a medical oncologist, and trained at the Sloan Kettering in the United States. So he's got impeccable credentials, but guess what? He's an alternative cancer doctor. So I don't care what you think you know about cancer. If you have loved ones who are busily staying on the internet all night long because they've got a daughter who's got osteosarcoma, they've got some major problems, please know that this book, it's $2,500 on Amazon. You must buy. It's only 790 pages. But anything you want to know about, whether it's Wobenzyme or carnivora or high-dose vitamin C or vitamin A, anything you want to know about, because this gentleman has the data that proves to you that so-called terminal cancer patients, that's the people that are told to check into hospice because you're too late to be helped. He has so many of them alive after 10 years, but of course he's knowledgeable. And he doesn't take a purist attitude. If you are a person that doesn't believe in chemo, he will treat you. He's not going to beat you up. But he knows how to use hyperthermia in order to make all things work better. And hyperthermia would be heat. And if you use electricity, or you use light called laser, or you use magnet, you're into physics. So I need to have everybody aware that this was quite astonishing, that on April 1, Time magazine had the audacity to put this cover out, How to Cure Cancer, as though they knew. They sold a lot of magazines, but they weren't telling you anything, because what I am telling you makes what they are saying look like they're beginners, because they don't want to talk to any of us who have natural, non-patentable cures, because there's no money in what we do. So they're announcing that, why, there's going to be this huge breakthrough. We're going to cure cancer now. How come they're saying this big announcement? Well, amazingly enough, big institutions like, say, Stanford are going to share their knowledge with Johns Hopkins. Is that amazing? We put in billions and billions of dollars since President Nixon started the war on cancer. And now, after all these years, we find that all those people we gave money to see themselves as the greedy owner of the intellectual property, that they're going to make their university worth billions, and they're not going to tell anybody else what they found in the laboratory with our tax-supported money. So, yeah, there's going to be some improvement, but not for a while, because they're going to give the money to the same non-productive, dead-end modalities like chemo that have gone on for years. But there's some hope. This tells you a little bit about why they call it a dream team, because they have actually competitors now talking to each other and sharing some ideas. So it's not all bad news. It's a premature announcement, and somebody who just lost their child a week before with cancer is going to feel kind of bad when they see the headlines thinking that there's something happened they didn't know about. The only thing that's happening, folks, is the alternative medicine movement around the world, which you can access if you're a health professional at no cost by going to gordonresearch.com and joining my fact forum. You will have access to 10,000 posts from doctors in 13 countries sharing how we treat anything from multiple sclerosis and autism to prostate cancer and breast cancer and brain tumors. But on May 30th, I will be at the Omni Hotel in Dallas. I've just been in Dallas for 2 conferences. I was at the Omni Hotel, but this conference is kind of interesting because friend of mine, Mark Hyman, that really runs the Institute for Functional Medicine and treats people like former President Bill Clinton, is putting on a conference, and it's been sold out for 2 months. 1,000 doctors are going to attend it, and they're paid $1,000 a piece, and you can't even get in the conference no matter how much money you got, because they only got so much room, and it's sold out for 2 months. But they're going to talk about microcurrent and laser and pulsed electromagnetic field, craniosacral guided image. So I want you to know that what we're talking about here, without charging you $1,000 and making you fly to Dallas, and interestingly enough, we have knowledge, because I'm dealing with doctors in so many countries who are using their creative juices to add a laser to a PEMF, to add that to an ozone, to use that with a hyperthermia, and doing that with vitamin C, and doing that with what we call insulin potentiated therapy. The list goes on, folks. So this is the conference that was right after the ozone conference. Best answer for cancer. Now you'll see on this one slide, which is that's how can you take a whole organization and boil it down to one slide? You can't. But they started out doing a lot of work with IPT, low dose. That has made a lot of doctors really think they're crazy. They give you an injection of insulin, and you're not a diabetic, and they make your blood sugar so low that you really get hungry or a little weak. Boy, it sounds crazy. But the data, it was started years ago for treating serious infections like hepatitis, because everything worked better, because insulin injections seem to do a little bit of what I can do for you with the pulsed electromagnetic field and laser. So I applaud these doctors who have taken the time to learn how to use IPT, and it sounded kind of scary, make your blood sugar so low that you're kind of weak. But when it's low, cancer cells get really hungry because they're hogs for sugar. And so the net result is, when you give the treatment, whatever vitamin C that you're giving actually has a chance of going into the sick cancer cell, because cancer cells are unique with maybe 200 times more appetite for sugar than regular cells. That's measurable by the number of sugar receptors on the cell. So all I can tell you is that if you have a loved one that is fighting cancer, you need to find somebody by going to How You Find a Doctor and look at this group. Because this group has me speak twice now about why the PEMF and laser might be an alternative to people who don't even want to do low-dose insulin. Although I have nothing against low-dose insulin, it clearly buys really sick people time. But that's not all they stand for. Because the doctors in this group and people include people like Jim Forsyth. He's a board-certified oncologist from the University of California, San Francisco, practicing in Reno. And he's been doing this for 35 years. And he has solid data that no one can question, because our sick, corrupt government tried to invade his office with guns drawn, with a SWAT team threatening every patient and every employee to lay on the floor, they'd be shot, because they wanted to stop him. But embarrassingly for him, he found some real attorneys. And they stole every computer and every patient chart, and the net result is they talked to those patients, and every patient he said that he's treated that's alive was alive and was there answering the door. So they had to put and return everything, because there's no fraud. He's the real thing, folks. And when he tells you that these people masquerading as the real doctors because they can milk your insurance for $100,000 for some quack chemo remedy that allows you to live maybe 2-3 weeks later, but longer than you would have lived, but you feel terrible, lose your hair and poison your body. How can you fight a poisoned cell with more poison? It makes no sense. But what he is able to show is that these people who sell you their crazy, useless chemoradiation approach to cancer, I have nothing against taking the tumor out if you just are lucky enough to find one of these doctors to be on the right program, because taking the tumor out is never going to cure cancer, because cancer is a systemic disease. You can't cure a systemic disease by taking surgery. But I like taking big tumors out. It's fine. But what we need to understand is that Dr. Jim Forsyth in Reno can show that his worst data from years ago was 5-year survival of 38% of all cancer patients, no matter what kind it was, lung, colon, didn't make any difference, breast, prostate. These are patients that are what we call the tough cases. These are the patients that actually had the problem of the tumor having already spread. We call it metastatic cancer. And so these patients only have a 2.3% survival after 5 years. Whereas the patients he's treating, the lowest result he had is 38%, and now with some exciting new things that we can't get into today, but I do private consultations and I'm happy to help you learn, because I can't possibly download everything I learned in Brazil, everything I learned when I was in Monaco, and all the things I learned in 2 back-to-back cancer conferences. And this weekend I'm going to another cancer conference with very high-level presentations. But I can tell you that we have a lot of good doctors, and we have to match the patient to the doctor. But what he does, we need to have you send your blood somewhere. If you work with Dr. Forsyth, and he'll send it to Greece for $400, he'll see if they can see the tumor in your bloodstream. Yes, at least 60% of patients who have been told their prostate cancer is just in the prostate have the tumor already in their bloodstream, able to be picked up by a $400 test. Now, if they find your tumor, what are you going to do about it? Well, they can grow your tumor for another $4,000, and now all of a sudden they can test your tumor to see what really kills it. So all the therapy you think you're being done, everything you think you're being told, is what I call yesterday's medicine, and I'm trying to help you learn today's medicine. And so since I've been at all these cancer conferences and all these leading conferences, I have to push the words into your ears. I talk a lot about PEMF and I talk a lot about laser, but I need to give you some words. I have a picture of a mouse. The mouse is to remind you that the magnet called PEMF that people are buying for $23,000 in the United States, much more money in other countries, and they're leasing it for a little over $500 a month in the United States. This device is not FDA approved for the treatment of depression. That's the NeuroStar, and they deserve the $60,000 they charge, but they do want you to be treated 1 hour a day for 6 to 8 weeks, and they want to apply it directly to your head, and you could bill your insurance because they have the FDA approved one. We are only approved to actually use for assisting the benefits of your exercise. And what's the benefit of exercise? Autophagy. And how does it work? Well, like the magnet, it opens up the membrane, that's the shell around this cell, so that a little bit of nutrient can get in. So now I have the mouse telling you, the mouse is to remind you that the magnet is inducing exercise of your cell, M-I-C-E, cellular exercise. And now he's got a broom in his hand because he's going to clean the toxins out of your body. Now when I take the toxins out, it's going to make any 1 day, 1 week, 3 week, I don't care who you see in the country, I don't care who you see in the world, it's all nonsense. There's no overnight detox, and throw that out. It's a lifetime program, folks. I took over 200 IV chelations. I still haven't got the lead out of my bones. You can't get it out because it's not even IV chelation strong enough to take lead out of your bone, but I can keep you on my oral chelation and my zeolite and my fiber and my organic green and my maca, and I can have you slowly catch all the lead your body releases as you make new bone. And of course, you lose a lot of bone when you're hospitalized with a broken back because you can't exercise, you lose bone. And you lose a lot of bone when you go through menopause. So women get hypertension because they release so much lead, because nobody gives them the little things I teach you to be on, which is my oral chelation and my zeolite and the whole program. But when you do have the nutrients get into the cell, the toxins are going to go out, so you must have EDT in your body and vitamin C and zeolite and fiber. So the pulsed electromagnetic field is the spark plug. I make this following example. You are a cell phone looking for your charger. You find the PEMF and you feel different. If we only treat your head for 3 minutes, your back for 3 minutes, and treat you over your buttocks for 3 minutes, you will feel different because we've recharged you. It's the charge you're looking for. But for people who do get the big charge with the pulsed electromagnetic field, now you can use the laser in the nose and pay $300, $400, $500, and It's a trickle charger. It keeps the charge that the big machine. So if you have a doctor within 300 miles who has the big machine, you don't have to lease it for 500 a month or buy it. You can drive to their office, and many of them are nice enough. If they charge single visits just to come in once, it would be $75 or more for 10 minutes on the machine. But when you prepay 10 at a time, many of them let you have 10 treatments for $600 or less dollars. So you save money, and now you have that prepaid ticket, and you can let your wife who sprains an ankle or your son who's been having some serious problems with depression get his head treated. So the nice thing is our exercise applies to any part of the body. If you buy the NeuroStar for $60,000, it only treats your head. But the important thing is this. PEMF improves the microcirculation. It gives oxygen to the cells, and it helps to regenerate nerves, helps in pain management. So now they're admitting that a lot of people who were told you had to have some kind of knee surgery, tells out they're now admitting your body is able to heal. A lot of people who've had a shoulder problem and have been told it must be operated, that turns out it's nonsense. Your body has tremendous healing power if you have the patience. But of course, not everybody's going to have this thing at home like I do. So that's why I came up with the laser. So if something to keep the energy moving forward, and I'm not against microelectric. There are nice devices out there. Cherry Tenet has what we call the biomodulator. Avazia has a device. I mean, microelectric current's been around. They used to just call them TENS units. Alpha Stim has one. The point is microcurrent is giving you a form of electrons, and the laser is giving you a form of electrons in the form of photons, which in what we call quantum mechanics become electrons. And electrons are what you're lacking. Anything that hurts, that's unhappy in your body, grab vitamin C because it's an electron donor. And you need a lot of vitamin C, and so we have the proof now that no vitamin C can compete. Nothing you can buy anywhere will give you a better level of vitamin C in your tissues. How can we prove that? Very simple. For $10, we send you 50 tests that you take a little strip that's about the size of a toothpick, and it's painted green on the bottom of the toothpick. And when you do that, you are able to actually see the color change. And when that green becomes yellow, you will have a bright future, because yellow means you have a lot of vitamin C in your urine, which means it was in your bloodstream, which means you're protected when you get stuck behind a bus and have to breathe their fumes for an hour in traffic, or you fall down the steps. So there's an important thing to put all this together. But it's the idea of electrons that are going to change your life, because we know that PEMF, pulsed electromagnetic field, induces more what we call ATP. ATP is the provable measurement of energy inside of your cells. And so if we look at the big picture, why is that important? Well, this slide should make you sick. This slide is the tip of the iceberg of how badly people in this country are being treated by mainstream medicine. After all these years, they're going to have to sit there and say, you know, when we gave you that chemo, we now think maybe the chemo didn't go to the tumor. It just killed your immune system, which is, where does your immune system hide? Well, some of the most immune system in your body is in the intestinal tract, which is why I have everybody who wants to stay alive a long time on my power drink and acidophilus, because the intestine is where all of these diseases, that's where aging starts. When the intestine, when the gut isn't working, you start aging. But the point is that I'm now telling you that they now are saying to say, you know, maybe all we did is kill your hair follicles, so you lost your hair and you lost your immune system, because now they're saying, you know, those tumors have a funny thing about them. They have so much pressure that they don't, inside the cell, that they don't pick up the chemo that we're poisoning your whole body with. So here you, why do you have cancer in the first place? Well, Otto Warburg explained that when he had this Nobel Prize. He said the cancer only grows in the cell that was toxic. It was so toxic, it couldn't convert the oxygen in the food that you eat into energy, so it chose to go to a more primitive form of metabolism that doesn't give you much energy. That's called anaerobic, and it makes the cell very acid, and that cell does not pick up oxygen. So that's what you're fighting, and that's true for anything in your body that's sick. So you need to understand, when I have you go to one of my doctors and he gives you vitamin C because vitamin C in the vein is proven at NIH to kill any cancer. There's no cancer we've found that it can't kill. I repeat, whatever they're telling you that vitamin C is a joke, they are not telling the truth. But the problem has been dose. You have to have a big dose, which is why we teach you now to see some of our doctors that are listed in the Best Cancer to Answer and learn. And it's true that when we add IPT, we can make a smaller dose go further because your cancer cell gets so hungry when we give you the shot of insulin, make your blood sugar low for a while, that it will pick up more of the vitamin C or the low dose chemo. So there's method to everything we're doing, but all of it is much easier when you learn energy. So on the GordonResearch.com, if you click on the word energy, read what it says under laser and understand that we've been using lasers for 10 years in China. Almost 1 million of these intranasal lasers have been sold. Now I mentioned $300, $400, $500. What's the difference? Well, if you're already at a point in your life when all too often you can't find your keys or you walk in the kitchen, you don't know why you're there, you need the $500 one because it pulses and it's at a longer wavelength. A10 is designed with the intention of helping restore neurodegenerative diseases, whether it's Parkinson's disease or autism. So the $500 one is a slightly different one. The $300 one is enough to help a lot of people who are really just fighting and need more energy. As I said, the trickle challenger. So it's a no-brainer for $300. If you read what is on my website, it's cheaper than any supplement I can sell you because it is producing electrons continuously, and your nose is loaded with blood vessels. That's why you get slugged in the nose. You can lose so much blood. But here's what we're telling you in this thing is that the drugs they're giving you for your cancer are not working, and it's also applicable to the same non-drugs that many of my colleagues are doing, and I'm trying to wake my colleagues up into offering you pulsed electromagnetic field so that if you're taking just vitamin C, it can work better, because it's always good to have vitamin C no matter how you get it, orally, IV, I don't care how you get it, but the more, the better. See the two books, Cancer, Curing the Incurable, and the other book is, both by Tom Levy, is Primal Placebo. And what you need to have is the knowledge that vitamin C always wins, but it's dose related. So I now need to get the dose to go to that tumor that's in your leg or in your brain. And that's why it's important to put all these pieces of the puzzle together. So here's the big word, folks, electroporation. If you just look at that word, you are able to put that word into Google, and you can become so knowledgeable that you're going to wake up the doctors who like you, that want to practice medicine, and the other ones are going to throw you out of the office because they're not going to like you. But it says, when you go to Google and you put in the word electroporation, you will find Wikipedia comes up, and if you open Wikipedia, and it explains to you what this is talking about, how for a moment, each time it beats, there's a little increased opening in the membrane of these unhealthy, sick cells that are starving and need magnesium and vitamin C, and that little opening allows the magnesium to go in and the vitamin C to go in that unhealthy sick cell. And then if we get our stuff in, the cell no longer stays so acid, and if it's not so acid, it will pick up oxygen from hemoglobin. So this is a pretty big story, folks. So this is what we're talking about, electroporation. And everybody that I treat is getting a benefit because the Earth magnetic field is down 95% from what it was, so you don't have the power. So electroporation, if you read Wikipedia, they'll let you click on stories where cancer remedies that didn't work are starting to work when they add electroporation. So please understand that electroporation is a huge story, as you can see from this Journal of Membrane Biology. And we're teaching you here that if you give a sufficiently strong electrical field, there's increased permeability of the cell membrane. That's a little of what we do when I give you IPT. The insulin injection seems to increase the permeability. But our trick here is powerful. It's so obvious. You won't believe how much better Wikipedia reports some cancer therapies starting to work. So electroporation is allowing a cell to commit suicide. That's called apoptosis. And once the bad cell stops reproducing itself, you're over the hump. It's these crazy cells that don't stop, and they keep making baby after baby that are the uncontrolled growth. So please understand that PEMF increases the membrane permeability, and that is basic to the success that we're seeing. And now I can switch the topic and say the magnet is inducing your arm to move, or your leg, or your brain. When I put it over you're going to see better. Your vision will get better. Your memory, your judgment, you stop falling, because what we do is we wake up cells in your body, just the same as if any part of your body you exercise, but the magnet is inducing the exercise of your kidney, so I don't have to have people go on dialysis. So it's very important to understand what we're doing. So this is the report from the New England Journal of Medicine, an entire review article of the importance of this word. So if you test your doctor and he doesn't know what the word electroporation is and you've read it, you may want to find another doctor. If he's never heard of autophagy, all doctors know what apoptosis is. Apoptosis is the out when the body says there's nothing I can do, I just have to commit suicide, there's no other out. Apoptosis is when the cell says, you know, I think if I got rid of all the garbage in here, and so I can give you a cleansing Herxheimer-like reaction. I can get a skin rash. I can give you 3 days of flu if you're not lucky enough to remember to take my high-dose oral, well-tolerated vitamin C in the doses of 8 to 16 grams a day, and my zeolite along with my maca and my green and my fiber. If you take all that, you can take a lot of PMF, and I don't care how many toxins you release, because I'll capture them. But you've got to have my stuff inside of your intestinal tract day and night. How come? Because you breathe in stuff and it's poison. You drink fluids and they're toxic, and you eat food and it's all toxic. Monsanto has poisoned our planet with their Bacillus thuringiensis idea. It was a wonderful idea. They told the farmer, we'll put the pesticide in the food, so you won't have to buy the pesticide. And our Bacillus thuringiensis is great. It tears up the guts of the insect so it dies. In 1 year of using Monsanto-based GMO food, we had 40% more children having asthma. So if they think it's good, I think they're outrageous. But it's always hard when they're making so much money they can buy every politician. But just understand, we're telling you the words autophagy is the cell needs to have these things that are, see, the cell actually lives longer than the pieces inside the cell. It's like you repaired the furniture in your house once in a while, you might even get a new stove or a new refrigerator. Well, the cell has things, organelles like lysosomes and peroxisomes and Golgi apparatus and things where you make your energy, mitochondria, and they can get sick and need to be thrown out. But if you have a housewife that doesn't get out of bed, who's going to clean the house? So that's what we're teaching you here, is autophagy in cancer. So I think you get the idea that I'm pretty enthusiastic about what's going to happen. We're talking to you about a revolution in the treatment of cancer, and that everything you're being told is not the whole story, and knowledge is doubling every 2 years, and anybody that you trust who tells you there's no other choice hasn't been to the meetings I've been to, because he doesn't know anything about hyperthermia and where to put the ozone and how to do it. So the book I told you to buy for $25 is a lot cheaper than buying the book Cancer as a Metabolic Disease for $120 by Tom Seifert. But both books make you an authority, because the first book for $120, Tom Seifert, tells you that if you trust the chemo and radiation, you're probably buying a bill of goods, because we now know it makes more of the cancer cells resistant to later therapy. And these cancers come back 5, 10, 15 years later, which is why I want you to buy the book for $25, Living Without Cancer, by a board-certified oncologist. The book is fully referenced and it's up to date. This book will make you the source of information for your family and loved ones. So autophagy means you're going to have a clean cell. But there's going to be a lot of toxins. We've had a couple people that did actually feel bad for 4 days, a huge skin rash. It's possible if we don't get, so I normally, when I even give anybody their first 10, I usually don't go over 10 minutes with your first exposure to the PMF, because I haven't had a chance to introduce you to my green drink, power drink, the organic greens, the maca, the Beyond Fiber, the high-dose bioenergy C. That's the only vitamin C that any cancer patient should use, because it goes into your cells and it doesn't upset your stomach, and you can take a teaspoon in the morning and a teaspoon at night, and that little test for how much C is in your body that you will buy for $10, 50 tests, and that way you test your loved ones, and they won't always be sick, because anybody whose test on the urine stick, 20-cent test, if it stays dark green, they have a dark future. If you want to teach them how to have a bright future, you tell them Dr. Gordon has a vitamin C called Bioenergy C that's saving lives. So you need to know that all of this is about autophagy and cleaning the cells. You have to understand that exercise, of course walking around the block is still essential. I can only do so much with a magnet, so don't think that it means you don't have to walk around the block with your dog. But it's all tied to the story of how to stay healthy. And you need to know that we believe that what we're doing is through nitric oxide, and nitric oxide is the molecule of the year a few years ago, and it totally determines how warm your feet are, but that's not what we're important. I want to know there's enough blood going to that tumor that might be starting in your brain or your bones. There's enough blood going there that I can feed that area enough nutrition that it doesn't choose to become a cancer cell. These are problems that cells are choosing, because if you simply send your blood to Mount Sinai School of Medicine, you fail. How do you fail? Well, they take 20 tubes of your blood, you send them a check for $4,900, they measure 220 things, including polybrominated diphenyl ether, dioxin, PCBs, and bisphenol A, and you fail. Nobody passes the test. Bill Moyer on television has lived organically since he came back from China with Nixon. He is loaded. You cannot be on the planet. There's no escape. We wanted to flame retardant so the children's pajamas wouldn't catch fire if the house burns down. And it's in every airplane, it's in every human, it's in every mammal in the Arctic and Antarctic, and that's one of the reasons that your sperm count that used to be 140 million is now 100 million. Don't think you are above this. You are involved. This is not your neighbor. This is not your mate. This is you. Everybody fails the test. Now, you may not care until it really catches up with you, but when you realize the Alzheimer's Foundation says 1 out of 2 at the age of 85 will need a keeper because you won't find the bathroom. So pay attention. When you walk in the kitchen, you don't know why you're there. You are losing something. I can tell you that we have the herbal remedy from Thailand called HRT. It is a miracle. It is actually proven to be a selective estrogen receptor modulator of the beta receptor. Wow, who cares? You care. If you do one simple thing, you go to the little place called Google and you put in the word Harvard aged mouse study, and you see an old mouse getting young because it was given an SCRM beta, the synthetic one called tamoxifen, and we give you the natural one. So you don't get breast cancer, and you don't lose your memory, and you don't get broken bones, and you don't have vaginal dryness, so you have to give up sex because it's too painful. So PEMF is pretty powerful stuff, and it blocks pain. You need to understand that it increases circulation. You need to understand that this is pretty simple. It makes the cell communicate to the next cell, and it increases the ability of cells to repair. That's how 50 years ago they knew that you could put a PEMF on a broken bone that hadn't healed for 2 years, and they'd fiddled around and operated and daily physical therapy, and you still had 2 bones that weren't knit. And all you did is put the PEMF over it, and did it daily, and all of a sudden growth factors came out to happen, and stem cells are caused to come to repair what wasn't working. I repair my brain every day. I put the pulse magnet little butterfly over my head. It's 2 loops, and I regenerate my brain daily because I've spent millions of dollars going to meetings in every continent, regaining my health so that at 78 I can feel able to have the energy to do these things. But you need to know that this is actually documented that you'll increase the energy in your cell if you just sleep on a magnet. And so Dr. Bonley does a good job. He sells you a magnet. It's called Magnetico Sleep. He's in Las Vegas. They cost in the neighborhood of $3,600 for the 4 pads that you need for a king-size bed if you want to have 20 Gauss. And I like my pad, but it didn't make me younger. It didn't give the power because instead of a 38%, so he's helping people. And it's been fantastic because he woke me up to what a magnet could do. But I'm now telling you that we're going not to 38% increase, we're going to 380 or far above that because I need to regenerate you so that you get younger and feel as good as I do, and it all requires energy. And energy is measured as ATP, and it's the pumps, the sodium-potassium pump. Who cares about the pump? Well, I care. Because if you don't maintain the gradient across that membrane, let me make it clear to you. How do you think death occurs? when you have a really sick cell, it has a calcium pump, and there's 10,000 times more calcium outside the cell than inside. And if you can't keep that out, it's like the little boy with his finger in the dike. If you can't keep the calcium out, immediately that calcium leaks into the cell, and by definition, any unhealthy person is magnesium deficient. And see one of our doctors and walk in and say, I need to have a Meyer cocktail. It is B complex and magnesium, and it changes lives, because no matter what is wrong with your body, when the energy is low in these pumps, too much calcium is in the cell, too much sodium is in the cell, and you need the potassium and the magnesium. So those are the good guys. So this is what we're talking about. Got a bad shoulder? Don't get it operated. These idiots don't tell you how bad off the operation is. They don't help you. You don't need back surgery. You don't need it, but you have to spend your money, because everything that I teach is in the cash market. Nothing that we do is approved. But you need to know that ACIM, ACIM Connect, is the website for this group, and we're doing another conference coming up in June. We'll be in Texas. And these are some of the speakers that we've had at previous conferences, including Dr. Simona Pop, who's right here. She's the lady from Vienna who, as a dentist, is telling you that when nobody can help you get your tumor markers and you're still worried that you're going to die of your ovarian or prostate cancer because the tumors test look terrible, all she did is say, let's get the bad metals out of your mouth. We all know what that means. A lot of money. And then we put you on a program once we took the bad metals out, like the mercury amalgams. And then we put you on something to catch those poisons that were poisoning you. And when she did that, everybody started getting healthier. All their tumor markers for ovarian cancer is a pretty nasty disease. CA-125 started coming down halfway, but amazingly enough, she took half the group and gave them laser for 10 minutes to the abdomen and 10 minutes to the brain. She wasn't using the intranasal. She was using one that I like that's pretty fancy from Medical Electronics, Dieter Josner in Germany. It's a little more pricey. They sell for $20,000, but you don't need, because you don't have to have it done in 10 minutes. You have the laser, and you have it at home, and you can use it in your nose for 25 minutes twice a day, and you don't spend that kind of money. But here's her research. This is Dr. Simona Pop, and she shows that if you're sensitive to mercury, gold, platinum, that's one of the reasons your cancer won't go away. And she tells you in this group of 30 patients with cancer, they had not been able to get rid of the cancer because they had been trying for 10 to 25 years using the standard nonsense chemoradiation surgery that they use. So she put you on the detox to get the heavy metals out. I have you on my power drink and my zeolite, which is far stronger than taking this, but I love vitamin C. I have everybody. That's my power drink. And the glutathione is in my Zeo Gold. And the selenium is in the Beyond Chelation, the Beyond any multiple BAM that's in the Beyond Chelation formula. So across the board, then all you're down to is half the patient got laser, half they didn't. And when you see that the group that got the laser, in every case, had almost complete return to ideal normal levels of tumor marker, which they hadn't had in years. Every doctor, every patient wants his PSA to go back to normal. Now we have a pill that is doing a remarkable job. It's called Myomin, and it is working as an aromatase inhibitor that's totally safe. It even makes fibroids go away. It even helps every woman prevent that breast cancer thing from coming back, because as Dr. Joseph Brenner says in his book, Living Without Cancer, cancer is always waiting to come back. It's a lifetime program, folks, and I can tell you I have patients who I made the tumor go. I mean, patient would come in with me, and they would have cancer in their bones, their lungs, their liver. It would be in the brain. It would be in all the nodes. You could see the cancer just looking across the room, and it would go completely away with my program. It's using vitamin C and Wolbenzyme, all the things we do. And the amazing thing is, these patients were so dumb that when the cancer went away too fast, they decided they didn't have to exercise, they didn't have to stop drinking, stop smoking, get to sleep, they didn't have to cut down the alcohol, they didn't have to stay on the supplements. And the cancer always comes back, roaring back. But somehow, some of the good Lord decides to give some people a second chance. And we treated them a second time, and the whole tumor went away. You don't give 3 chances. If you stay on my program for that second, third year, and you finally say, oh, I'm out of, I don't need to spend, I don't need all these pills, I can go back to, I don't need, you will be in trouble. Once a cancer patient, always a cancer patient. Do not think that there's a cure. There's a control. So you need to know that lasers are even helping people get rid of cocaine addiction. So you've got to own a laser in your life. And the $500 one is what you better buy if you have any concern about your brain. If you're really strapped for funds, the $300 one does a lot and you'll feel a difference. And this is the one from Israel. And my doctor friend, who is from Israel, Dr. Joseph Brenner, says this laser is totally known and talked about every day in Israel. They all know this was a breakthrough. Lasers have been around forever. I don't care what laser. You can get TQ Solo for $2,000 in this. I don't care what you buy. You can get good, excellent ones from Erconia, as little as $6,000 to $2,500. I don't care where you get your laser. Lasers are just one step in my solving the equation. The equation is you have an electron deficiency, and I have to give it to you. When I have the new Zeogold enhanced, and we have more hydrogen in it in a month or so, I'll be getting you more of these electrons, but you can't get too many electrons because you have challenges. No one can pass any test on toxins. Everybody's loaded, so you can't pass the test. So this is the people in Israel using that BQ laser. And we have great stories of gymnasts that have been out of practice. For 5 years, they've been a cripple. They couldn't do all the things that a gymnast does. And using this on their back daily, 3, 4, 5 months, they have 80 and 90% recovery. So this is treating your back. This is no-brainer. But you can do it with the nose one. The nose one, even though it's convenient to go in the nose and it's less expensive because it doesn't have the fancy handle that this one's got, you can take the nose one and do the same thing to any part of your body. You hold it over the bad shoulder or the skin on the back of your hand that's going into cancer, and you see things get better. So this is no-brainer. I don't care if it's foot out. This is not complicated. No house. I mean, there used to be that no house would exist that didn't have a thermometer in the house or maybe a blood pressure cuff. Well, this is as automatic as having a glass of water. You should have a laser in the house because this is the before and after of a guy who didn't have to have the leg amputated because he used laser. This is what the one does when you have the one for the nose. This is absolutely, the $300 one lights the nose up so it's bright like this. The $500 one is all laser so you don't see the light. But you can look at it with your eye and see that it's there. So the $500 one isn't as impressive just from the point of view of a picture, but it's impressive if you are interested in the amount of new photons/electrons that I deliver to your brain cells, because anything in your nose is within inches of your hypothalamus, your pituitary. Putting it in your nose makes it directly applicable to training your brain. And it increases nitric oxide and blood flow. This is a no-brainer. Go to my website, click on the word laser, and read. There's 30, 40, 50, 60, 70 pages there, including top stuff from Dr. Liu in China. He's the head of the Chinese Institute of Technology. He works with the top people in Russia. And we have the top guy in Harvard who's reporting. I mean, lasers are out there, folks. There's nothing magic about them. I'm just trying to make it so that you don't have to spend money to pay $50, $60, $70, $80 see a doctor who's got it. I want you to have the power, because we can even treat and see growth come back on the skin. So I like what the lasers are doing, and this is how we did it in Russia for a while. We used to put it right in the vein. This is a laser put in your vein. That's not. Now, if I can get the same amount of benefit by sticking it in your nose, why would you stick it in the vein? The veins could get sore after a while. They could get infected, because this is where you are when you've got it in the nose. You're right next to the cell of Tursky. When you go up in the nose, you are aiming it right at the key thing of your body. Your pituitary is what makes all your growth factors. It's why I take my product Beyond GHS, 3 of them every night. So at age 78, I still can open doors. I don't get weak because the pituitary releases growth hormone. I take it in a tablet, but this way my tablet does more because I put the laser in my nose and wake up my hypothalamic pituitary axis, which is the governing part of the brain. The pituitary is the master gland of the whole body. So with Parkinson's, you're talking about different ways out there today. And now they have doctors putting a probe directly into your brain, and it will stop you shaking. So that's a tough way around the horn. I'm showing you the easy way. I have nothing against somebody putting a probe in your brain, because a lot of people aren't going to change their diet and walk around the block. A lot of people don't want to detox. It's too inconvenient, and what I take is darn expensive. So there's room for everything. If you're going to live at McDonald's, then there's room. You can stay on Coumadin. I don't have anybody taking Coumadin. If they're my patient, they're on Beyond Chelation Improved, and they take something as simple as Buluki, which is stronger than Coumadin and totally safe and will dissolve a clot if you've just had a stroke or a heart attack. But this is the brain cells actually coming back to life using a laser in the nose. And this is the history of the proof that intranasal low level can help insomnia, migraine, traumatic brain, schizophrenia, cerebral palsy, early loss of memory. I mean, look at it, folks. It's all, and it's going to get better. This is from Dr. Lou Lim, and he's really tried to explain to you what you do when you put this light into the brain. You're doing some powerful things. And it's right between that nose and the brain itself. There's just a very thin little bit of bone, and believe me, as you can see from the picture of the guy's face, it's lighting that up. You're getting energy through that bone. You are helping the brain, and you're turning on growth factors. That's the problem. You know, we grow old and we don't have any muscle because the body thinks you've given up living. That's why all my patients take HRT, 1 tablet twice a day, herbal remedy from Thailand. It is the one that is directly related, but it's the safe, natural form of what Harvard used with the synthetic tamoxifen estrogen receptor modulator, because it has side effects and I have no side effects. My side effect is that you don't lose your brain, you don't lose your bone, and you don't wind up with vaginal dryness, and it actually causes regeneration. So this is the mechanism of action. You've got all these cells in that nose, and you're putting that, when you put that in the nose, you're coming right up to the actual olfactory tract, which is going to restore actual smell to people. You're going to regenerate nerves. Now, obviously, it's nice if you're lucky and you don't live too far from a doctor who's got a PEMF. And you can get there once or twice a week and pay him $35, $40, $50. Most afternoons are going to be around $50 for a 10-minute session. But that's the master charger, like for your cell phone. If you don't have a charger for your cell phone, it becomes useless. And you become useless if the Earth doesn't charge you. Remember, if you move to Mars, you don't get charged and you're dead. It might take 2 days, but you really get very weak first because there's no metabolism. So you need to know this is the amount of blood vessels that you can see in the nose. So when you put it in the nose, you are getting it the same as putting it in the vein. And all of a sudden, the blood becomes less sticky, and you have all these benefits: increased ATP, increased endorphins, so you have less pain, improved blood circulation in the skin so that the skin doesn't break down like it does in diabetes with all these diabetic ulcers. And you're going to change the permeability of the nerves, so the nerve is going to pick up nutrients. So this is not too difficult, but you can realize that it's going to help in hypertension. Yes, it does lower blood pressure. To spend $300, put it in your nose every day for 25 minutes, do it for a month, look at the literature. It's going to drop your blood pressure a lot more than many of the dangerous drugs we give you, while you won't need to be on the statin. I repeat, the nasal intranasal will replace the statin. How come? You need to go on the website and read, because it even stabilizes your blood sugar metabolism. And as I showed, you can even help stop cocaine addiction. So whatever you're having, whether it's insomnia or post-stroke, it's important to know these are pictures that is actually making the hands warmer, because you're working through nitric oxide for a lousy $300. I can't sell you any supplements that you can use every day of your life for 25 minutes in the morning and 25 minutes at night while watching television or playing cards. I don't care what you do. Be at the computer working. This is not a complicated decision. These are what the laser has been proven to help. Alzheimer's, dementia, high blood pressure, sinusitis. Who doesn't have that? With the air quality today, insomnia, depression, Parkinson's. With the economy, everybody's depressed. So look at, these are the choices: $300, $400, $500. And I repeat, $300 is great if all you're doing is you have got some, and that would have the bright red color. There's no bright red color when you use the 810, but we talked with Harvard, and this pulses, and for that reason, Harvard feels they like this one better. And see, that's the pulsing is continuous versus 10. So this explains to you that you are getting, for the additional $200, you haven't thrown the money away. Remember, They have fixed this so you can drive a car over it. It's not going to wear out. And you can put the batteries in. So now you're back to the big picture. Why are we sick? Lead. Lead is the underlying problem. So I have you on oral chelation every day of your life because IV doesn't take it out. And everybody laughs at me and says, Dr. Gordon, you know it's only 5 to 13% absorbed. If it's only 5%, why would you bother to have people take oral chelation? Very simple. I haven't had a patient die of a heart attack even if they were told they shouldn't leave the hospital. Their heart is so plugged they could die in a day. And people trust me because I tell them very simple. If you die on my 9-pill called Beyond Chelation Improved, if you die taking those 9 pills twice a day, the good Lord really needed you because to my knowledge you'll be the first one in over 10 years. I don't get people because they don't do it. If you have already had a clot or a stroke, we'll add Beluki. It doubles the price from $130 a month. Now you're more like $260. But the point is, you don't need their drugs, and their drugs are killing you. The side effects of statins, one day there'll be a massive lawsuit. It's not just the diabetes, it's the muscle pain, and it's the negative effect on brain repair. That the lowering your LDL, they don't tell you one word. If you lower LDL, you're lowering progesterone. Read up on what progesterone does. It's brain-derived neurotrophic factor. Please learn. Go to my website. Try to learn that it doesn't say media, it now says webinars. Click on there. I have put 30, 40, 50 talks, all fully backed with everything I'm telling you. And we have it so that you can go to this site. You click on fact if you're a health professional, and you join 3,000 of your colleagues who are all talking like we're talking. Or you click on where it says what's hot, it's now called energy, and that's where you'll find all the research on the laser. I do consultations. If you get your doctor on the phone, I reduce my $300 per hour fee to $150 so that he can help deal, as in this case, more doctors is better because there'll be follow-through. Because I'm traveling so much, I can lay out and record for you in my consultation what I want you to do, and we can get you some sophisticated tests, but it's nice if you have a local doctor. And I thank you for your attention today. And we hope there are questions from you that we could answer. If we don't get questions now, please don't hesitate to deal with info@Longevity Plus so that we get your questions answered. Thank you for your attention.